All right, so I'm going to go ahead and get started. Good afternoon, everybody, and welcome to the SHIFT 2021 Connect Conference. My name is Victoria Hamilton, and I am one of the students in the conference course this year. On behalf of our class and our professor, Dr. Ren Thomas, I'm pleased to welcome you to this event hosted by the School of Planning at Dalhousie University. We are grateful to be able to live, work, and play on Mi'kmaq, the traditional and unceded territory of the Mi'kmaq people. We are all treaty people. We thank our Dalhousie University Elder in Residence and guest, Jerry Musca LeBlanc, for opening our conference with a blessing this year, as she has done in previous years. Jerry is a proud woman from the Knockaway First Nation. She is a mother, a grandmother, and a great-grandmother. Jerry's traditional name is Red Eagle Woman, and she is a Bear Clan knowledge keeper and pipe carrier. Jerry has received the Queen's Diamond Jubilee Medal for her work in social justice and employment equity. In December of 2015, Jerry took on the role of coordinator of the Elders in Residence program at Dalhousie University. And today we appreciate and thank her for coming to the SHIFT Connect conference to share her knowledge. I'll now turn it over to Jerry.
Thank you very much. I just wanted to mention that I think we're all aware now that one of the first steps towards reconciliation is acknowledging the people in their territory. And of course, in Nova Scotia, we acknowledge the traditional people, the Mi'kmaq people, and their territory, which is Mi'kma'ki. I am not Mi'kmaq. I am Anishinaabe Kwe from Kiscoons in Saskatchewan, but I do thank the Mi'kmaq for allowing me to practice my traditions in their territory. I have been invited to open your conference, and I'm very honored to do that. So I am going to say a prayer. And of course, you probably all know at this point that when I say my prayer, I pray to my Creator, and I ask you, I invite you to pray with me, but to talk to who it is you talk to when you pray. And the first couple of sentences, I'll use my language because I have to let Creator know who I am and why I'm here. Aninsikwa, Indisna Cosmos Quiganukwe, Makwayan Dodem, Nakaway Anishinaabe Kwe, Kisakus, Gizolk, Chimanitu, Great Spirit, we honor you with this prayer. Great Spirit, good Creator of all things, grandmothers and grandfathers of the four sacred directions and the four sacred races, please hear our humble prayer. We offer prayers for those that are grieving, those who are sick, and those who are traveling on the dark road of abuse. Please give them comfort and strength and guidance to find a healing red road. We pray for strength and courage to work toward the positive change. We give thanks for the resilience you give to us in our times of need. Gizolk, we acknowledge the gift of the two spirit people you have given us. They have the gift of seeing the world from 2 points of view. Help us acknowledge that when the dawn of a new day arises, it rises for all your children. Kichiminitu, we give thanks for the gift of life and for those who give of themselves to protect our freedoms. Walalan for our Mother Earth, who provides us all that is needed to live. Walalan for the sacred water, for quenching our thirst and helping things to grow. Walalan for the four sacred winds that give us air, the breath of life. Walalan for the sacred fire, the sun that gives us light and warmth. Walalan for all our relations, the four-legged, winged ones, swimmers and crawlers, and plants and rocks that enable our nations to live today. We teach our children to honor Mother Earth and our sacred waters. We do this, Gizol, so that our future generations will have a safe place to live and to grow. Sitnokmak, all my relations. Thank you so much for listening or for sharing that with me and listening to the words. And I hope that they are able to reach home. What I'd like to do is just give you a little teaching on what the traditional roles of elders are. I'm sure a lot of you know what they are at this point. We've been at Dalhousie for at least 6 years. And certainly SHIFT, and this is not my first time I've been with SHIFT conference, so I know that you've had done some research and know that what it's all about. So just let me tell you that elders are those people that have earned the respect of their own community. Elders are looked upon as knowledge keepers. And the thing to remember is not all old people are elders. and not all elders are old people. Every elder has their own expertise, their own area of expertise. My area of expertise is traditional knowledge. Someone else's area would be to help people with addictions. Someone else would be to help single mothers whose children are taken by childcare, whatever. So we have all those. Every elder has their own area of expertise. Elders have always been the gatekeepers of First Nations. We traditionally hold crucial roles in supporting both formal and informal education in the First Nations communities. And it has, I'm going to say it's been, it hasn't been historic. It hasn't been a historic time where we encourage people to do the formal education, like the Western education. But it certainly took us a little while to realize that we need we need Western education to be able to survive in today's world. And of course, part of that is all reconciliation, and the part of the colonists are, they are learning what our history is, which is great because everyone is sharing their knowledge and we're all moving forward. Elders traditionally hold, we traditionally share knowledge, culture, values, lessons using orality, and a lot of our lives are role modeling our traditional practices. We carry with us our original ways. We're considered elders because of our life experiences. Like my life experience is the time I spent in residential school. So I spent from kindergarten to grade 7 in residential school. And so what I was able to do, and I was blessed, Creator blessed me with this, is that rather than having, going towards addictions in various, drugs or alcohol, I was able to get past those memories and turn those memories into lessons of how we could survive. We teach others about our culture, about our tradition, about the vision of life that is contained in our philosophies, and that we hand down in ceremonies and traditional teachings. And all of our traditionally, all of our teachings and all of our education, everything is handed down orally and in ceremonies. We have no writing, nothing is written to pass it down. We're able to assist you through difficult times by sharing stories and lessons of our experience. And for this reason, we're quite often asked to sit with groups that are faced with making important decisions. And the thing is, elders do not tell you what decision to make. Elders will share with you our experience. If we had an experience in that particular issue or that particular sense, we will share with you how we survived, how we passed that. And so the decision making is still on your shoulders. You still have to do we can't tell people what to do. And of course, the inclusion of elders in all these processes is described as the heart of First Nations teaching, because we are the ones that hold the traditions. We're the ones that hold, the culture. We're the ones that hold, all the values. The other thing that elders do is we value an open and trusting relationship that doesn't need a formal agreement. So, it's very difficult for non-Indigenous people to understand that being an elder is not the same as running a business. And the reason I say that is because a lot of people, a lot of organizations will call and say, we need an elder to come and, can you come and do this for us? And so we talk and we figure out what it is they want. And we say, okay, this is fine. We can do what it is you want. And then they'll call us back and say, can you send us an invoice? No, we can't send you an invoice. We accept honorariums. We do not say, you need to give me $500 for talking to you and showing you this. We can't, the knowledge that elders have, elders are, what we do is we share the knowledge that we have. And because we are quite proud and we are quite thankful that we are given this knowledge, that we are thankful to share it. So calling me and asking me to sign a contract or to sign, send you an invoice for something, that's the same as running a business. And being an elder is not running a business. The most commonly used values in Aboriginal ethics are respect and reciprocity. And this is a good little bit here for researchers. Researchers need to negotiate the role of the elder in community-based research in such a way that the elder is not offended, but is clear about what the researcher wants. Advice about the research, collaborative participation in the research, or participation as the subject of the research. It's very important that we understand what the researchers need and what the researchers want. Researchers need to demonstrate how they will show respect for the realities of the community, the cultural values, and community structures. And they need to show how the research will benefit the community, not just the researcher. So if you want to do some research for a community, you're going to have to show elders in that community how is the community going to benefit from it. It's not just going to be the elder receiving an honorarium and the researcher walking off with all the information they got. You have to show and that's the thing, like we're a collective. We always work collective. We don't work just for ourselves. We work for the whole community. Elders are the carriers and emblems of communally generated knowledge. In the Western paradigm, such relations and processes of knowledge transmissions are considered informal. Yet, these same processes are at the heart and soul of what is formal to Indigenous knowledge. Elders are first and foremost teachers and role models. They are vital in the teaching process, from infanthood to adulthood and beyond. We quite often surround ourselves with our great-grandchildren, our grandchildren, people like small children from in the community, so we can teach them. They can learn from us. We tell them stories. They can learn from us various things. And then comes the teenagers. And then, comes the 20, 30, 40-year-olds. And then eventually they're adults, they're elders themselves. Our students understand that the traditional knowledge possessed by their elders is acquired over the whole of a person's journey. It's not a 3 to 4 year process akin to a university degree. Elders are a source of subjects of First Nations cultural practices, traditions, and protocol. They also educate non-Aboriginal people in an effort to promote respect and awareness of Aboriginal culture. They act as encyclopedias of history, healing, and humanism. As elders of our time, we seek to be a conduit for the wisdom of our elders, of our ancestors. We seek to take the accomplishment of the settler's way further by blending them with the wisdom of our ancestors. Knowledge of the physical should not be separated from the wisdom of the spiritual. So with that knowledge passed on to you, I wish you good luck in your conference, and I hope it's a successful conference. Thank you very much.
Thank you very much, Cherian, for coming today and sharing that bit of knowledge with us. I wanted to say how much we appreciate you doing that. I'd also like to extend our thanks to our sponsors, the Atlantic Planners Institute, the Licensed Professional Planners Association of Nova Scotia, Turner Drake and Partners Limited, FBM, Fathom Studios, and ZAP Architecture and Planning. I am pleased to welcome and introduce our first panel on food access for the SHIFT conference. Today we have four panelists. Leticia Smiley from HRM as an experienced senior planner with a focus in community development, food security, and cultural planning. As a member of the Halifax Food Policy Alliance, Leticia considers how municipalities can improve access to healthy, affordable, and culturally appropriate food, as well as strengthening local food systems. Leticia is particularly interested in how planning can help improve community health. Dr. Catherine Mah is a Canadian Research Chair in Promoting Healthy Populations and an Associate Professor in the School of Health Administration at Dalhousie University. She also holds appointments with the Dalla Lana School of Public Health at the University of Toronto and St. Mary's University. Dr. Mah directs the Food Policy Lab, which is a multidisciplinary program of research on the environmental and policy determinants of diet and consumption. Her research is supported by the Canadian Institute of Health Research, the Social Science and Humanities Research Council, and the Heart of Stroke Foundation of Canada, and the Australian National Health and Medical Research Council, known as NHMRC. So among her networks of scientific collaborations, she is a Chief Investigator for the NHMRC Healthy Stores 2020 trial, an Associate Investigator in the NHMRC Center of Research Excellence in Food Retail Environments for Health, as well as in the Atlantic Co-Lead for FLEdGE, a SSHRC Global Partnership on Sustainable Food Systems at Wilfrid Laurier University, and a founding investigator for the CIHR PROOF Food Insecurity Team at the University of Toronto. Tinashe is an Associate Program Manager of Community Food Programs at the Center for Immigrants and Community Services, known as CICS. CICS is a nonprofit organization located in Scarborough, Ontario. CICS community food programs offer gardening, healthy eating, environmental programs that help build and strengthen social and environmental connections among marginalized populations. The program organizes a community food pantry and seniors meal program and help engage different audiences such as new Canadians, low-income families, seniors, youth, and single parent families. Tinashe is also a member of the Toronto Food Policy Council and the Scarborough Food Network. And then lastly, we have Rekha. Rekha is a Senior Programs and Partnership Specialist at the Community Food Centres Canada. She holds a Master's in Social Work from Dalhousie University and has been working in the nonprofit sector for 20 years. Rekha has used food as a method for connecting with individuals through her social work practice, and for the past decade has worked more directly in the food insecurity field. In this work, Rekha implements innovative practices and provides consultation on creating inclusive, healthy, and socially just oriented food programs. Rekha has been working at CFCC since 2017 and supports the development of building community food centers across the country. I wanted to thank all of you for being with us today, as we're very excited to be able to have someone with your expertise join us and share your knowledge for the SHIFT 2021 conference. So before we begin the panel this afternoon, I wanted to just go over some of the details of this session. So as you know, we'll be using the Zoom webinar software, which allows only the panelists to speak. So for the attendees, you'll notice that there is a Q&A icon in the bottom of your screen along the panel, which you can use to post questions for the panelists at any time. And as the moderator, I will refer to them after the panelists are finished introducing themselves and the work that they do. And second, along with me, Dr. Thomas and Eric Lindsay and Travis Nickel are here, who will be assisting as needed by taking notes, screenshots for our websites, and helping with any connection issues that we may have. So for a general timeline of today's session, each of the panelists will be given 10 minutes to introduce themselves and the work that they do, and then we'll go into our Q&A session. So, and with that, I will hand it over to Leticia Smiley, and we will begin our session.
Great. Thank you very much, Victoria. And thank you very much for inviting me to be part of the conversation today. As a Dal grad from the School of Planning, I feel really honored to be part of this amazing conference, which every year really brings up fantastic topics. So thank you for inviting me here today. There's so much stuff going on in food locally, and it's all very exciting, but I'm going to really try just to touch on some of the highlights here today so we can get into the juicy part with discussion and questions later on. But also always happy to share information that you see here in deeper discussion later on, so just feel free to contact me. So in my role as a community planner with HRM, I've been acting as the municipal rep as part of the food conversation since about 2013, at the time when we were updating our regional plan. At this time, HRM, so Halifax Regional Municipality, the Ecology Action Centre, and Public Health came together in recognition that we really needed to be working together to promote food security, and that we needed to bring everybody together who was doing a lot of amazing work. We really need to bring them together and try to amplify the conversation. And so this led to the birth of the Halifax Food Policy Alliance, which is based on the vision of a Halifax region where no one is hungry and everyone has access to healthy food that they enjoy. It has a vision of a region where people and food are celebrated, where our local economy is strong, and the environment is protected for generations to come. So a founding goal of the Halifax Food Policy Alliance has always been to develop a regional food strategy and to create a governance body who could implement that strategy, but also be kind of a centralized space or place for food in our region. I'm happy to announce that in 2019, our council approved Just Food, an action plan for the Halifax region, which is to be developed and co-led in partnership with the Halifax Food Policy Alliance. So at this point, we have a plan framework that we're engaging on, which is based on the principles of the Halifax Food Charter, which was adopted in 2018. So Victoria, I'll get you just to put that first slide on. And this is just around kind of why is it that we're calling this Just Food? So food justice is at the core of Just Food, recognizing that while food is a universal right, there are many inequities that impact food sovereignty and food justice. Food justice is making sure that the benefits and the risks of how our food is grown and distributed are shared fairly amongst us. Food sovereignty is really the right to healthy and culturally appropriate food that's produced sustainably, as well as the right of people to be able to define their own food system. So with Just Food, we're really seeking to increase our understanding of food justice and to increase capacity for food sovereignty. The name Just Food is also a bit of tongue-in-cheek because, as everybody here knows, food is much more than a just. It's the bridge between cultures. It's the knowledge that's been carried through conflict and oppression. It's the juggle that we all have between shelter and other costs of living. And it isn't just the Halifax region. It's really about being part of a much larger food shed. It's also not just a municipal plan or just a public health plan or just an Ecology Action Centre plan. It's really about collaboration and collective impact to increase our understanding of the issues, to build on our strength, and to create the system change that we really need to make sure that everyone can get the food that they want in a dignified way that respects their culture. It also means that people who are working in food are paid enough, that our food is sustainably produced for generations to come. Okay, Victoria, we can stop that one. Thanks. So as I said, we're kind of at the engagement stage for Just Food and are planning many different forums to create lots of opportunities for people to be part of developing the plan. So while they're going to be in different formats, really this first round of engagement is about communities defining what food justice means to them. It's about testing a framework to see what is in it that works, what's in it that might need some more work, and really mobilizing us towards action. Okay, Victoria, there's the principles and food system goals there. Thanks. So on screen before you now is a snapshot of the principles of, so it's probably two from there. There we go, perfect. Is a snapshot of the principle, one back, sorry. Great. The principles of the food charter, surrounded by some draft food system goals. And these are what we're going to be challenging through our upcoming engagements and what we plan to build on to create tangible actions. And these actions will be supported by the mechanisms that are needed to make them a reality. So they'll be supported by the commitment from people and organizations, by budgets, by programs, policies, and also sort of performance measurement to make sure that we can check to see if we've got it right or course correct if we haven't. So to create a just and sustainable food system, using the charter principles as the base for this, we're really committing to social justice. So recognizing that we all eat, and we're supporting this with a goal to increase access to good food. Food is also crucial for our health and well-being. It nourishes us and it connects us. So this is supported by a goal of growing knowledge and skills to empower communities to grow, get, eat, and share in good food. It's supported by a principle of the environment. Food and the earth are precious. So we need to support this with the goal of enhancing the ecological resilience of our food system to produce, share, and eat food in ways that protect the environment and our future. It's based on a local economy, so recognizing that local farmers, fishers, and producers are essential parts of our food system. And it's supported by a goal of strengthening our regional economies, which will help us strengthen our communities and help us to adapt to changes in the world. And finally, last but definitely not least, is the principle of celebration. So food is what brings people together. And we're going to support this with the goal to celebrate our cultures and traditions and learn more about each other through food. Okay, great, that's it for that slide. So there's been a lot of stuff that's been happening around food during COVID. I would say that it has been a challenging time to kind of launch a plan right when COVID hit. We had a pretty significant loss in some of our people power because our key partners in this work are public health, and they've been redirected towards the COVID response. It's hard to plan engagement when you can't use traditional formats. It's hard to kind of generate the buzz that you would often, in the typical ways that you would use. But I would actually say that this time has really strengthened Just Food. And I think it's increased the support for the plan, increased the recognition of the major issue we have with food insecurity in our region, and also I think increased the likelihood of us getting positive change. It's meant we've kind of explored some interesting ways of engagement. So we have a survey on COVID-19, similar to Cathy Mah's survey. And so that's both online, but we've also been sharing that through postage paid envelopes so people can use hard copies. At the beginning of the pandemic, we were able to send out supports for gardening at home, from seeds to container gardens. We've done funding for food hampers through the mobile food market. We've had some kind of fun, soft launches of the plan through things like Banda bars and coloring sheets and crayons going out in food hampers. And we're also hosting a series of workshops starting at the end of the month. And we're planning for opportunities for others to be able to host engagements in the way and the format that works for them and the groups that they work with. So we have an engagement toolkit that supports that, but also civic dinner kits, which provide everything that you need to make a meal together and have a conversation around what food, Just Food, could mean to you. I also think there's been, as I said, much better increased recognition of the importance of access to food and support for food system. Food has really been on everyone's minds during this time, as well as a recognition of an increased and important role for the municipality to play in this work. And as well as it really provides an opportunity for us to learn from this time. So what are the strengths in our food system? What are the barriers? How can we use this time and this knowledge that we're gaining to increase our resilience to future events, really build in support that is needed for all the amazing work that's been happening, and fill in the gaps and the stuff that's been, that's been really highlighted as being an issue in our local food system during this time. So I've been focusing mainly on Just Food. I'm also really lucky to be part of the team for the mobile food market, which has been delivering healthy and affordable food to communities with food access challenges since 2016. And the mobile food market has been doing amazing things during this time, including serving 19,000 people and over 164,000 pounds of food delivered to communities, which is an increase of 3.5 times the volume of food and 4 times the number of people just since last year. So in this period of time, they've been doing amazing things. I'm also part of the Food Communities Network, which is a pan-Canadian group sharing research, resources, best practices, and kind of lessons learned, really, amongst people who are working on food at the regional level. And there's been lots of really interesting things happening at the Food Communities Network as well. So I'm happy when we get to the question time to speak to any of that as well, if folks are interested in finding out about that. And Victoria, there's just one last slide there about the workshop that's upcoming, and I'm done. And it's just one more. Yep, perfect. Yeah. So as I say, there's a workshop happening at the end of the month, and it's one in a series of 3. It's really for anybody who is working with or supporting food. And it's about an opportunity to learn more about our food system, to build on strengths and fill in gaps and move together towards action. And we have lots of supports for participation. So we can, provide an opportunity for you to meet in person, to connect virtually, computers, per diems, transportation, all of that kind of stuff. So if it's something that you're interested in, please contact me about that. We would love to have anybody and everybody participate. All right, that's it for me.
Thank you very much, Leticia. I'm now going to turn it over to Cathy.
Hello, everyone. Thank you so much for inviting me to join you today. Oh, I do think somebody's on. I hear some noise there. If everyone could go on the mute. Thanks so much for asking me to join you today. I did, in honor of the planning conference, although you can't see it, wear my map shirt. It is a Newfoundland map shirt. I don't have a Nova Scotia one yet. So please, in the chat later, tell me where I can get one. I would love to know. So maybe I'll start my remarks by saying that it is very easy to think that food access, if we open up the newspaper or look at our social media feeds, it would be very easy to assume that food access boils down to just a couple of things: taste, cost, or convenience. And sometimes a little bit of health that we might see there. But, and I don't need to do this introduction to a planning conference, but what we really know and what we live every day is that food access is not only about those proximal factors in our decision-making, they're about how our lives intersect in the food environment and how we navigate those food environments to make those food choices. So for example, during COVID, it's really become evident that, when we make those decisions to go to the store, our lives intersect with everyone else who is making those choices at the store alongside us, or the lives of shoppers with employees, or who we're shopping for, who we're shopping with, why we went to the store in the first place, whether we decide to stay home and order the food or actually go there in person, how we got there, what mode of transportation, whether we walked or took public transport or actually took a car or a bike. So all of those factors are what we refer to as the food environment. We make food choices in our neighborhoods, in our communities, in our food systems, and our food economies. And because of those things, the food environment is very much about both the physical settings and the built environments in which we're choosing food, as well as the interpersonal interactions in our communities, or how our social lives engage with other social lives when we're in those store or restaurant or market environments when we're choosing the food. What COVID has also demonstrated to us about the food environment, however, is that where our food system and our food environments are precarious or not promoting of health, or present barriers or present violences against communities where they have health inequities, well, COVID has really shone a light on how these parts of our food environment are really precarious. So it gives us a real opportunity in terms of planning and policy to hone in on these potential areas and to ask, what can we do better? How can we bake health, and how can we bake social equity? And to refer to Leticia's initial comments, how can we bake food justice and food sovereignty into the design and planning of our communities and our public policies so that food access, so that the healthy food choice is the easy choice for all who live in a community. So I lead the food policy lab at Dalhousie University in the School of Health Administration, and we look at the environmental and policy determinants of diet. And what does that mean? So it means those things that I've been talking about. It boils down to two big sets of factors, the economics and the geography. And from economics, I do mean issues around household food insecurity, as well as the cost of food, all the way to geography, including the human geography, as well as spatial access to food in our food environments. And as a couple of examples of these, and I'm eager to discuss some of our projects, as well as talk to the other panelists about this. On the economic side, for instance, we're particularly concerned about food economics in the Atlantic provinces because of our very high rates of household food insecurity. We have among the highest rates of household food insecurity, particularly among households with children. 1 in 5 households in Atlantic Canada with children is food insecure. So what we're looking at in one of our studies, the diet cost study, one of my PhD students is looking at how the cost of our diet affects the nutritional quality of the diet. In another one of our studies, we're looking at the geographic aspects. So our Healthy Stores Newfoundland and Labrador study is looking at access to retailers across the whole of the province of Newfoundland and Labrador. This study in particular has been affected by COVID. And we're looking at also the role of those retailers and their own choices in the food environment and how they might affect community food access. Finally, our lab also looks at interventions. So an example of this is in our Healthy Stores 2020 trial, which was done in partnership with remote Indigenous communities in the Northern Territory. The company that we worked with is an Indigenous governed remote store corporation that operates in the Northern Territory as well as Northern Queensland. And in the Healthy Stores 2020 trial, we looked at reducing merchandising to sugar-sweetened foods and beverages in the remote store environment and how that might affect diet. So I'm happy to talk about that example a little bit as well later on. So essentially, what I'm trying to say is that when we're talking about food access, we're not talking about any individual person. We're talking about the interaction between those people, as well as the social and spatial architecture of food access. I'll always remember actually I spoke at a planning conference, the Atlantic Planners Conference in St. John's. And I'll always remember that we have a particular design game. We do a design charrette sometimes. Back when we were allowed to go to conferences in person, we had a design game that we called the Healthy Corner Store design game. And the idea was to use a floor print of a potential small convenience store in a community and use that as a design initiating conversation with a group. And just prior to the Atlantic Planners Institute, we had done this design exercise at a public health conference, and a lot of the focus had been on the foods that were sold inside the store. So people spent a lot of time laying out their store, deciding what they would sell inside the store. However, when we went to the planning conference, almost all of the blueprints that we handed out, people started talking about the signage, the sidewalk that was outside the store, the vehicles and where vehicles might access those stores. So really, by studying the intersection between, economy, nutrition, and geography in our food policy lab, we're hoping to bring some of those discussions a little bit closer together and essentially show how health is a resource that can be baked in to the planning and policy of our communities and therefore become a resource for our future health. Thank you.
Thank you very much, Cathy. I'll now turn it over to Tinashe to talk about the work that you do. Oh, sorry, I think you're on mute.
Sorry, forgot about that. Been listening for a bit. I would like to thank you all for inviting me to this conference and highlighting CICS and some of the work we do there. I'll give you a bit of a background. CICS is a newcomer and settlement organization based in Ontario, Scarborough. And most of our work relates to settlement, but we also are involved in community engagement activities. So our department is in the community services, but the core of our organization deals with settlement. So we have link programs, we have an early years program. We also have settlement programs in schools. We have senior support programs too. So within it, our organization probably has about 150 workers across the GTA. So we are kind of really a big organization. And in terms of demographics, majority of like the audience, we do it probably from a Chinese background and Arabic speaking. Within my role at CICS, I've been at CICS for the last 2 years working in what is called the Enrich Project. And the Enrich Project is a food-based program that really was centered on building connections. Unfortunately, COVID really provided like a counter narrative because social distancing was exactly what we were avoiding in terms of our project, and using food to bridge relationships between different cultures and then newcomers as agency of entering a new space. But a lot of it was really around building connections and social bonds through food. And most of it was activities based at a center in the garden, all hands-on. And I guess COVID really made that very difficult. And when you look at some of majority of gardening program participants, they're also in the elderly adult stage, so plus 55 plus. So that's also a different group of audiences in terms of just when we had to shift from a person to digital. And that gave us a little bit of a challenge because there's always been a digital divide, and really the seniors are really people who are really hands-on. So that really gave us a challenge. We tried to even do handing out seeds. They have gardens, most of them in their backyards, trying to work through the phone, not kind of the way they wanted. But I think after we had gone through some regulations, we started to have some youth and seniors come in groups of 10 and looking at the social distancing. So we were able to get back to function with a few, but could not run our summer camps with the early years or the youth and children. So we really had to adjust. But on one side, we also had emerging needs, which was really at the beginning, there've been food banks that have been run by libraries as a short-term plan, and the libraries had been shut. But when the libraries opened up, we then had to take on the task of taking one of the food banks that was at the libraries, which then led us to actually implement, change our warehouse into a food pantry. Now we are feeding between 100 to 135 households a week, which sums up to 600 to 650 people a week. We open 1 day a week. We're also working with social housing as a partner where community members come in. Actually, we do the boxes and then they do a pickup and then do distribution on site. This was to support, this program is to support single moms, because we realized they always had a struggle around moving with the family. So if you didn't have transportation, so within that program we have 35 households from social housing. It's a pilot, and we're trying to see how we can expand that. And in terms of the broader network, I think from the Scarborough Food Network, I think we've been working on a lot of culture and ethno-cultural based strategy. So what we've been looking at is currently trying to establish a collaborative through the Scarborough Food Network that would work on having a hub creating seedlings that will be distributed among our network of growers. During COVID, what we realized, the supply of seedlings became a bottleneck. And then also generally what we've seen, the diversity of kind of seedlings that's available on the market doesn't meet the needs of changing demographics that happens in our community. So I think from that place, we were trying to create a place that would incorporate some of the seed exchange activities that we're doing into also growing and sharing seeds and seedlings. That's also our key piece. And then we're also looking at having realized the gap between understanding people's needs during COVID is looking at stronger community reference groups and leadership opportunities so that in the future we may be a little bit more responsive. So in the process of trying to understand new food security needs or social connection needs, we are going to be looking at doing assessments as the season opens up. We'll be probably doing it digital, but we're having at least an audience of 250 families that pass through our food bank. So that's what we're looking at as our key audience of engagement. And we also have a seniors meal delivery program that does about 600 meals a week. So that's also another place that we're looking at understanding the new needs, which would probably be a lot about seniors. We can talk more as we go further in this.
Thank you very much for sharing a bit about the work that you do. And then our last panelist today is Rekha, and I'll have you speak a bit about the work now that you do.
Great. Thanks so much for inviting me to be a part of this panel. So I'm also a Dalhousie grad from the School of Social Work, and my first degree actually from McGill was in geography, and I did a focus on urban and environmental studies. So I feel like they're all really connected now in the work that I'm doing. So at Community Food Centers Canada, I work to develop and enhance and tweak food programs. And especially I have a focus on large food access programs. So things like food banks, affordable markets, and meal programs. So those are three large food access programs that I have had a lot of experience in developing and enhancing. And then the other thing that I do is I work to develop and build new community food center partnerships across the country. So a little bit about Community Food Centers Canada. So we're a national organization that supports vibrant centers and programs that build health, belonging, and social justice all through the power of food. So we help seed the transformation in low-income communities and bring us closer to achieving our vision of a Canada where every person has the means, knowledge, and voice to access good food with dignity. So since 2012, Community Food Centers Canada has been building a national movement to bring people together to grow, cook, and share and advocate for this good food. So again, we build and support well-resourced community food centers that bring people together to grow, cook, and share food and advocate for good food. So currently we have 13 community food centers across the country, and we are in the process of bringing on a few more partners. We actually have two out here in the east. So one in Dartmouth called the North Grove Community Food Center, and one on Ile Grande First Nation called Natawaganeg Community Food Center. And what we do is we provide another thing that we do is we provide grants to organizations so that they can offer respectful and responsive community food programs. And so we empower organizations to offer these high quality food programs by providing tools, resources, trainings, and networking opportunities through our Good Food Organizations program, which is another level of affiliation with us. And we have about 300 of those across the country. So we create these opportunities for all our affiliated organizations and share learnings, gather best practices, and continue to learn from on the ground from these organizations. So we also invest in developing these new and innovative programs that can meet the needs of our community. For instance, we have 3 grants at the moment. One is called Food Fit, which is a food and movement course, so a food skills and a movement program. We have another program grant right now called Mind Your Food, which focuses on youth mental health and food, and another one called the Market Greens grant, which is a program for building up affordable markets and using a veggie prescription program. And another big thing that we do is we advocate for policies that reduce poverty, food insecurity, and poor health. So we create these opportunities for people living in poverty with food insecurity through our partner organizations and other concerned citizens. And what we're really trying to do is to create this movement where like-minded orgs who work in food insecurity, we want us all to amplify what really causes food insecurity. So which now more than ever than before, it's really important for the public to know. So food insecurity rates were really not good before the pandemic, and they've just been really exacerbated, which I think some of the panelists have already mentioned. And it's weird to say, that food won't solve hunger and food access won't solve, this hunger problem, because it's really about a lack of food and that's as a result of a lack of income. And in the meantime, we do need to be focused on these immediate food programs and stay grounded in our communities and the cities that we work in, but we always have to, as well, we really believe that it's important to keep our eye on that long-term social policy piece. And, I think other panelists have said as well, COVID, it especially hit hard, our all food organizations, and especially with community food centers, I would say too, they're really place-based. And now, they seek to bring people together through healthy food related activities and programs. And a big piece of what we want to do is reduce social isolation and encourage community engagement and belonging. So that has definitely been a missing element during, the pandemic. And we, every year we do annual program surveys. And this year we really heard a lot about how social isolation and mental health are really key concerns, right? So people are, struggling to cope with this. And we asked our participants across community food centers across the country how they've been impacted by COVID. And there is that increased sense of social isolation. Loneliness was a common theme, along with worsening physical and mental health. And so this is, compounded by these money worries from income losses and the mounting food insecurity. So I think this is another aspect of food insecurity. And when we're creating these food access programs, to really consider these places where community members can really engage. And I think one of the biggest things that we were able to do this year for our good food organizations and community food centers was to provide over 1,000 grants, good food access grants. And in our last 2 rounds specifically, we targeted these grants to BIPOC organizations, BIPOC-led and serving organizations, because we know that COVID has hit these communities the hardest. But things are really hard for organizations. There's a lot of pressure being put on them to solve this, the hunger problem right now. And while they're doing their best, I think, and large food access programs are not a solution to hunger, but, we have to really work on talking about how they are stopgap, they're for emergencies, and at the same time, serve these folks with good, healthy, nutritious food, create really great environments that are respectful for them to receive this food, but also keep our, eyes on that longer term structural solutions so that we can actually end food insecurity. And lots more to say, but I'm really excited to get going with the rest of you on the panel. Thanks.
Thank you very much. I'll just take a minute here and see if the panelists have any specific questions that they would, not panelists, sorry, the attendees have any specific questions that they would like to ask before we dive into some of the questions that the conference team has prepared. I don't see any at the moment, but if any of the attendees do have any questions as we continue on this conversation, please feel free to just pop them into the Q&A box at the bottom, and we will be sure to answer as many as we can. So a lot of the conversation that you all talked about was this idea of the interaction between different processes that happen in cities and in urban and rural places, and how that has been impacted by COVID. So in the work that you've done, are doing now, what have been some of the biggest challenges around providing access to food during COVID-19?
I could start.
Okay.
So I think some of the biggest challenges that we have seen are the mounting numbers. The numbers have just been staggering for our community food centers and good food organizations. And so we're just continually hearing how some of them have had to, and just that, like that shifting gear, right? Like, so in what they're doing, they've had to adapt to delivery. They've had to adapt to food getting picked up. And that is kind of worrisome for a lot of these organizations, because they really pride themselves on serving folks in a dignified and respectful manner. So this is kind of taken back a little bit more to working in that charitable space, which I think people are really worried about is going to stick. And like I said, I think there's a lot of pressure right now put on nonprofit food organizations to supplement, what is happening in this increasing food insecurity, when really, there has to be some of that pressure being put on the government to take some of that reign. Another thing is because of the mounting numbers, and because a lot of these organizations rely on community members and volunteers to help run the programs, they're not able to come in. There's a lot of seniors who are at high risk for COVID, who aren't able to help out anymore, as well as other participants and just the staff at the organizations not feeling safe to have folks come in. So there's really there's a lot of capacity issues that I'm hearing about.
I would say, as a person who was never a food banker, I was really into building connections. I never even thought I would even run a food bank. And the situation just came right. We had the infrastructure, space. I'm part of a network. I couldn't even, I had to respond to the need. So within a period of 1 year, we have started running the food bank. My first week, I remember it was 46, the people I have on my register. And by the end of the year, I had 250 households, and I still kept there. I'm not taking any. So that's like fivefold for something that never existed within a year. So in terms of the numbers are also kind of scary. But once the numbers were there and I had the courage to actually keep myself and know my limits and ability, because I had another problem as you go deeper down, the nutritional quality. People were talking about this, that within what's being distributed, nothing is fresh just because of the logistical movement. The number of times I get high quality fruits and vegetables. So different. As you go further down between the statement of BIPOC, the most marginalized, so you're going to culturally sensitive food too. So that's not in the value chain of big flowing food. So the more you're getting into the finer details of what we were discussing. And so then I'm becoming now a fundraiser for halal meat, becoming friends with Kabul meat, and kind of finding a middle ground with that, starting to look for new ways of adding vegetables through not even the big stores, but the relationships with cultural stores that were doing it. So now you see the relationship between the businesses going into, for the eggs, not enough eggs for every family, just based on our partners never give us enough eggs. So then going into the regional farms, so that now you're doing on the gate purchase, but also using some of your fundraising and exchanging between buying, tax receipt, and please donate. So just a matrix of so many things coming into play. So you're no longer a relationship builder only within the program and community engagement. Now you're going to business engagement, anything works now. So much pressure of what you need to be, can be, and wearing too many hats. And the challenge also being a lot of the food is all processed, kind of high processed, you know, the more perishable and quality. And I've got to the point of then being able to accept that a filled belly is enough for now.
I'll jump in and just respond to some of what Rekha and Tinashe have been saying. You know, I've been having many conversations with other people who are working in food across the country, and this is some of the concerns that you've raised are such a huge concern. And going back to my point about kind of looking at, we arrived at COVID not on a baseline of everything was fine. We arrived already, you know, at COVID already on a baseline of communities that were very precarious, or where there was a lack of food access and household food insecurity. And then this is piled on top. So for example, like food insecurity research by my colleague at the University of Toronto shows that, you know, only about a quarter of household food insecure households may even access the food banks. So this is even like, if this is a huge overwhelming shift, like let's think also even about the larger shifts that may still be hidden to us, but will most certainly be seen in health effects like for many, many years to come. So my other kind of comment about kind of the need for charitable and emergency food provisioning that has really emerged is, one thing I've been thinking about is how this shows not only the need for social policy, but also that community organizations like are responding. And to me, that shows a need for communities to have greater involvement in the governance and control over their own food environments and food systems. Like, to me, that is the intermediate and where this fits into like the planning and especially municipal policy, and where a bridge can be built. Because like, if social policy is going to be something that the federal government, you know, 2 layers of government up has to handle over a number of years, and we do have a poverty reduction strategy coming, but what we can do is we can increase that influence and control. And I feel like that would be an important step forward.
Great, and I'll just maybe add a couple things. Everybody sort of captured what I've been seeing as well in my work. I would say from the perspective of the mobile food market, it was really challenging because this was the time when the demand for the service was increasing because we were providing fresh fruit and vegetables. I mean, that's basically what, you know, it's produce is what the mobile food market mainly distributes. And there was increase in opportunities as well. So the funding from the community food centers, restaurants closing and having all of this amazing food that had a very limited amount of time in which it had to be distributed. Everybody kind of trying to scramble to figure out how to best serve the communities at a time when, you know, your typical resources that you would call on, like your libraries as a distribution center or rec centers or the community organizations that we typically work with, were having to close their doors. So increased demand, increased opportunity, but lower capacity to deal with it. So, you know, all of the calls and conversations and all the things that had to happen to try to make new community connections to be able to serve people was a lot of extra work. And, you know, very challenging to do, while the people who were most impacted by COVID became even more disconnected and disenfranchised, and which requires a lot more effort to actually reach them. So instead of bulk deliveries to an organization, it meant delivering to individuals' doorsteps because they couldn't leave the house. So it's just that sort of, again, disparity between demand and capacity was real challenge at this time.
Can I ask a question of the other panelists? Can
of course, yeah.
I was wondering, there was one aspect of follow-up that I was wondering is that both of you spoke to, like Rekha and Tinashe, you both spoke to also, not only did you have to focus on the programming, then all of a sudden you had to do all of these other things, on top of the programming work. So what I'm wondering is if you could speak a little bit more to, what that created for you, but also what would have helped you more in terms of, supports for you and your organization in that context.
You want me to go first?
Yeah, you go first, Tinashe, because, yeah.
Also, Tinashe, I want to say hi, and I'm sorry we missed each other on the Toronto Food Policy Council. I just left as you came on.
Oh, yeah. Yeah, hi. I guess juggling, I think the hardest thing is I ended up having to tell my boss, I am so tired of being adaptive. So that's the first thing, because there was so much. Every day I had to make a decision, a real life decision for everybody, every day, for like 2 weeks. And they would requiring you to be thoughtful and intentional too. So I think that was the hardest, just having to have the elasticity to be present and create like things that happen. I think for me, the shift in organizational flexibility at a time where I also needed like quick turnaround. Without that, to be honest, it was a surprising shift in the organization too. So COVID has also brought some flexibility in very stiff places. And the support, really, fundamentally, there was strong organizational support and flexibility. A lot of resources from Cherian Foundation, which I would say thank you to, shifted from what was required right away from, you have to do this, building relations, to bringing most of my time to supporting the food bank, and then also management, really offering space, resources, not even financial resources and staffing. So I think for me, that's what gave it a little bit. If you were to be pushing like in the old time, you're selling a story, whereas it was more like bounce back, turn around, bounce back, and you're just tired of the bounce back, turn around. So that's the most critical thing that I would say. But the most obvious is, if I had given more money, I could have given, financial fluidity makes decision making so much more. I have to have my halal. I have to cut deals with people with businesses going down. So really, that would be, once I start getting a little bit more financial resources, I started breathing more. Now I'm looking at community reference groups because of just what you're saying. Decision making without bouncing back in community became very difficult, because every program I ran, they told me how to make it happen. So really bringing it at organizational level rather than the group level, where I always met it at a group level interest, it really had to be elevated at an organizational level, and has become the key thing I'm driving for, because it gives me a little bit more confidence that I have been critiqued, and I have a bunch of leaders out there that can also elevate the message, and it's their message.
I don't know if I can say much more than that. Tinashe's like, you know, I hear you. Like, this is what I hear from so many of our good food organizations or community food centers. The one thing though with our community food centers is that we do collaborative fundraising with them. And so like a really big, like Tinashe was saying, like money is the issue, right? And so we have built these 13, soon to be 15 community food centers with that sort of like as you know, sustainable as a nonprofit can be. We're really there to help them raise some core funding. And that really helped them and was really protective in them and being able to like really shift and pivot quickly. They had already developed a lot of these food procurement streams. They had already thought about food distribution. They did have to shift to deliveries and pickups and things like that. But they already had like the facilities. They've already had the vendor relationships, and then they really required the funding, which is what we were really lucky. We were really lucky to secure a lot of federal funds and quickly got those out to our affiliate organizations. And I think for them, that's what they told us was the biggest difference for them, because they didn't have to go and source out the funds. Of course, they had to source out some extra funds, but in the beginning, they could start with an injection of funds, and that was super helpful for them because they had lost capacity in other areas. The other thing we saw is that our community food centers were able to like support other food organizations, and sometimes they actually just took on their budgets and their programs for them because they weren't able to operate in this like, you know, this time when the demand just was so, you know, elevated. So yeah, so that's what I have to say.
So do we think like, has COVID also increased the separation between like community food solutions and also market-based solutions? Like I'm thinking about, for example, I don't know if it's the separations or so much as like it's changed kind of the interaction between like market foods. I was thinking about Leticia's example of the mobile good food market bus. I'm thinking about Tinashe, how you're saying like, okay, you have to negotiate now with like these food businesses who are, you know, kind of in conventional distribution and retailing, but then they are in their own kind of like challenges with COVID.
Well, I would say being a person who's working across I'm also on the Food Policy Council and Scarborough Food Network. I guess this is about a demographic like interest, because you have these sub-layers, you have the farmers markets, and then you have the good food markets, and each one has had a different need of advocacy based on spaces and places. Mm-hmm. And so you find that within the good food market, they've been still going on based on the channel that food share is also being actively moving on the emergency platform. But when you're looking at the farmers market kind of thing and market spaces, there's the tension between like what all other small businesses are encountering around, like, is it a safe space to go out? How are you managing this? So they become like in between. So I think they're in different spaces, yet they're part of the same system based on demographic and geographical placing.
Yeah, I wonder, Victoria, that might be a good transition to the next question, which was on this sort of differences there, where there was a question in the Q&A from Jens.
Yeah, it's a really great transition to kind of expand on some of the different challenges posed in isolated rural areas and small communities versus larger urban centers, especially around when we talk about that intersectionality, like transportation issues and accessing different food sources. So I don't know if anybody would like to expand on that and address.
I think that the digital divide in the rural communities was really highlighted during this time. You know, it was amazing that so many of our local producers shift to online ordering, to, you know, door-to-door delivery, that kind of thing. But a lot of the rural communities weren't able to access that. So I think that digital divide was an even bigger issue during this time, because everybody's trying to do things virtually and leaving people out for sure in the rural communities. I have seen some kind of interesting things that have been happening because for us, because our geography is so big, it's often been difficult for the mobile food market to serve the outskirts. But there's been some really interesting partnerships created. For example, the mobile food market is working with Musco Rider and community health boards to do, instead of moving people to the sort of eastern shore, actually moving bulk food deliveries that are then sort of getting into the community that people can access from there. And just, I really like that idea of sort of flexibility in stiff places. This is something that people moved on really quickly. Nobody at the municipality said, oh no, we can't be using the buses for that. Everybody was really positive and supportive of that. And I feel like that's a trend that's been happening, a lot more flexibility and faster movement, which I think we need to push to continue having that kind of responsiveness too.
I guess I'll just jump in with the Australian example here, because we're working in remote communities, and the difference to me, like during COVID, has been so stark between Canada's experience. I mean, in Nova Scotia and Atlantic Canada, we've been relatively fortunate with our course of the pandemic so far, but in Australia, we're already able to go back to doing food research and interventions and working with stores in remote communities. And that, to me, that seems really impossible in Canada still. It will be for a little while yet. So it really occurs to me it's always like a bit of a push-pull, because we need kind of control over the disease transmission in terms of the pandemic in order to get back to some of the social and community work that we're doing. But then at the same time, like the longer it goes on and the more we, so-called open up, if the pandemic is not under control and transmission is wide, then we also can't do the social and community things. So they're very tied together.
I think that leads into another question, is kind of addressing some of these challenges. I've heard a lot in your presentations prior to this discussion about place-based interventions and allowing communities to kind of take the lead on addressing and creating a more just food environment. So I'm just wondering what policy interventions that are place-based could have been implemented and should be implemented to kind of prevent and overcome some of these challenges and barriers you've discussed.
Well, I could talk about a cool thing that happened in Montreal with one of our, and I'm not sure if I'm answering your question, Victoria, so let me know. But as far as something that's kind of place-based in a time where you can't be place-based. And so before I talked a lot about just the mental health impacts too, right, of being food insecure. And right now, especially not just being food insecure, but also with COVID and the pandemic and having to not be, be able to gather and congregate with folks. So one of our community food centers in development is in Montreal, Carrefour Alimentaire Centre Sud, and they actually worked with the city and in their borough to develop one of the biggest edible street in Canada. And so it was really cool. So in the Ville Marie neighborhood, there's bike pathways and walkways, and what Carrefour did is they helped to build this edible street. And so it was like open to the public, but it was also a place where people could kind of, in a safe way gather. And so in that way, it was place-based as far as it was in, that location where they were, but it was really great because people could just go to that area. There was seating areas there. There was food that you could pick and eat. And there were staff who were there maintaining these, pots and beds along this pathway. So that was a pretty cool and innovative thing that I think happened with the city and this soon-to-be community food center.
I've been thinking more really from the innovation side, because the innovation requires to be informed. So I need a new benchmark. So this season I'm going into is really trying to understand what it is that people are dreaming, what is it that they're seeing, and that might help because I think the old vision, the old approach was informed by an old person. So now I think it's much more critical to have that conversation. It's also a transition since we've been distant, rather than constantly creating new things. It's probably regrounding, regrouping, and thinking about how we can restructure ourselves, but at the core, having the local that we always need to respond, being part of our discussions, and back again to the advisory reference group. No other greater kind of innovations required really good.
I'm really interested, and probably Leticia as well, like how do we organize then like these groups, like community reference groups or community governance boards, like in our Australian communities, it is an Indigenous governed board that actually runs the stores, all the way to food policy councils, which I know there was something that the conference organizers were also hoping to speak to. What's the right kind of group? What's the right representation on that group? Do the members of the group come as their own citizens, or do they come as representatives of other organizations? I don't have any answers. Today, you can see a theme. Today I have no answers, but only many questions.
Yeah, Cathy, I think that food governance piece is huge. It's great to plan on paper, but if there isn't anybody there holding the commitments, feet to the fire, it's just going to be another thing that sits on the shelf, which would be tragic to take people who are so busy and doing such amazing work to take their time and waste it. So I think, governance structure is a huge part of this work. We're thinking to try to have a get together with local food researchers in the spring, just to talk about some of the stuff that's happening, because there is a SSHRC grant right now through the Schulich School of Law looking at food governance for just food. So there is tons of stuff happening on that. So I think that's a big conversation too. One thing I was thinking too, just from a planning perspective, and not necessarily exclusively COVID-19 times, but really in general, thinking about place-based food planning, is that we really need to figure out as planners how to move beyond creating like enabling policies so you can allow it there, but we're not doing anything to incentivize it and to actually make this a reality. So it's great that I can have a garden and sell produce from my property, potentially, which is some of the things that we're looking at, but what are the incentives for me to do that? It might be great if we're enabling more or return back to the sort of traditional corner stores, but what are we doing to try to fund and what are the programs that we can create to allow for healthy food to be served in those corner stores? So I really think it's like we really need to be thinking much more about incentives and fundings and programs to go along to support these, because it's not enough just to create enabling policies. So that's, I think, a challenge for all planners.
I'm looking at it more as a question on social inclusion and accessibility. So it's the demographics, is it 2 women, 2 seniors, 2 youth? So it's an intergenerational. You're looking at who your audience are, and from the people you're looking for who's willing to represent their voice at board meetings. So really this is starting from organizational accountability, and next time taking them to the Food Policy Council, I go with them to the Scarborough Food Network. they go to the board meetings, at least you have people who are part of this institutional process on a day-to-day. And when you do assessments, they review what you do, you have some local level accountability. And I think that's the first simple step I'm taking before I see it going a little bit further is how am I being accountable within my organizational space, and within it, make that same accountabilities sort outside by resident, but not an organization. So I participate in a network that's for a neighborhood place-based, but within it, each organization is working to build leadership that's advisory within it. That's the messages that we bring along to the networks where we go that are organizationally driven, and we are also their support, their confidence, and we share, because I'm also talking at these tables for them. So I think that's how we bridge from the ground to the top, and the organizational accountability, the neighborhood network accountability, and then the council accountability.
Yeah, and I was just going to add, like, it's just so important to not be tokenistic when someone is participating, right? And that there's a really good mix of researchers, policy folks, community members, and also folks who run food organizations, right? Like, I think, and even community members from these organizations, where those community members can feel like they have credibility and a voice, and that things you know, that it matters, right? It's really important. And I think sometimes, a lot of times, there isn't enough discussion or diverse viewpoints that are discussed in these conversations. And it's often what I've seen, a lot of just groups of folks who always work together and gather. And I think there's got to be a really concerted effort to do that outreach, like Tinashe was saying, right? Like, and wait until you've got that good mix of folks. It can't just be people you agree with, that you've worked with for years. It has to be you need divergent thinking, right? And you need people who on the ground, people already have the solutions, right? And so researchers and policy folks have to be there to hear that, right? And these organizations and people are the ones who will implement it, right? With, like you said, Leticia, with that, these incentives and the funding, right? But it has to, we have to break this cycle of who we work with, right? I think, you know, even at Community Food Centers Canada, right, like, it was so important for us to target our last 2 rounds of granting to BIPOC organizations. We'd never done anything like that before. We hadn't seen good representation from our good food organizations, from Black-led and Indigenous-led organizations. And so we need to do that work and to build those trusting relationships. And that takes time, right? Like, so for people to get to know you. So anyway.
I guess, and it also takes, like, representation all the way to decision maker roles as well. This year, over the course of the pandemic, I joined with a number of other women, and we're starting a network of next generation nutrition leaders. It's a number of the initial task group has been academics working in nutrition, but the idea that it's not only kind of representation in leadership, but a whole new style of leadership of organizations might be needed.
Brianna just had a follow-up question for you, Rekha, about what the name of the community with the edible street was. Oh, you're on mute.
Oh, sorry. It was in Ville Marie borough of Montreal. I can send you, Victoria, the link to that, and will you be able to pass that on?
Yep, I can do
Brianna?
that. Sure.
Okay.
Yeah.
Yeah, I'll pass it on.
Thank you so much.
Yeah.
So kind of based on this discussion, it kind of led me to some of what these incentives and mechanisms would look like kind of on the ground, and if it's the work of existing food policy councils or food policy alliances throughout Canada to kind of take the initiative to develop those mechanisms, or if it should be more, or if a different structure kind of needs to be changed in order to address some of the barriers around access to food.
I have a question, potentially, it's kind of related to, well, I guess some of what everyone said, but Leticia was saying about, you know, what incentives are in place, like even if we do create these plans or these strategies. And it just reminded me that, yeah, that in some countries, like people have the ability to sell small amounts of products from their homes, which typically we're not allowed to do in Canada. But it just occurred to me that Toronto, for example, has this like apartment zoning, you know, for the tower projects. They have this kind of residential apartment commercial zone that they made for those tower projects, so that people who live within those buildings can actually operate their own small businesses. And I'm wondering if any of you have heard of initiatives like this, where people might be able to sell, you know, potentially, for example, ethnic food right out of their units or their homes. Yeah, that's just something it just occurred to me when Leticia was talking about incentives.
I've heard more about ghost kitchens, so I don't think this had to do with any planning. You know, at the margins is where it happens. People respond the way they want to, not how they're told
to. Yeah, and I mean, I would say that there's my senses, and I'm not part of the regional planning or the regional center team, so don't, I'm not the expert on this, but there definitely is a move towards allowing sort of more market gardens and more sort of agricultural small scale activity in existing neighborhoods in sort of established areas. You know, there's always the fear that when you put something in a planning document, you actually end up, as we know, you can end up controlling it or creating restrictions that you never wanted to put in there. So, I mean, sometimes it's better when planning documents are silent. So there's that kind of weird, you know, you want planning to help make it an opportunity, but you also don't want planning to get involved and make it worse. So, you know, I think there's been a lot of things that have happened sort of organically here, you know, with chickens. If the bylaw is quiet on chickens, people have been having chickens in their backyard. You know, they've been sharing backyards to grow produce and selling it on their property. And just kind of, yeah, hear no evil, see no evil kind of role for the municipality on that. So yeah, it's definitely, there's a lot of appetite to try to increase the ability for people to do food uses on their own property.
One thing that I thought was really cool that happened in Toronto a few years ago in the Thorncliffe neighborhood, which has a high South Asian population, is that, so they have these, so with market, they had a really amazing market in this park in Thorncliffe. And there is a Thorncliffe Park Women's Committee. I may be getting that name wrong, but it was a women's committee. And what they did is, so this park had a bake oven, so like for pizza that went along with the market and things like that. But people wanted a tandoori oven. And so what they did is this women's committee worked with the city. They weren't allowed, right? They weren't allowed. And so they worked to change some of these bylaws in the area. And so I felt like that was like a really cool, very local solution, you know, and really great outcome that came, so that people were able to have this tandoor oven, you know, to cook their foods. So yeah, so that was like that's one neat example.
This is maybe a response about the policy process. I think sometimes, you know, Canada is a very good country at doing royal commissions, and then we have like a beautiful report with 108 recommendations, and then we like shelve it. But what I think about where food strategies have worked, or where their power is actually not the on-the-shelf version. It's actually as an incentive to have a conversation with someone across the food system that you may not have otherwise in the course of policy and planning processes. So, you know, it gets like licensing, talking with, you know, health in a totally different way, and it gives them an excuse, like, or not an excuse, but really like it gives them a policy incentive, like an overarching reason to be getting together and discussing.
And I think it gives license for creativity too, because, you know, municipality is not rich in its pocketbooks, but it is rich in assets that are in communities that we want to try to help. So, you know, if we have a plan in place that says that we need to be maximizing municipal assets for food security, that's where you can have your demonstration projects, where we can have more, you know, community ovens, where we can have, you know, these pieces that can help to build the conversation elsewhere. So, yeah.
Yeah, I think Rekha's example there was really interesting because we, as a planner, landscape architect, we heard years ago about the Italian community in Toronto asking for a pizza ovens, outdoor pizza ovens. So a lot of these are really bottom up, like they're the community coming and saying, yeah, like as Rekha said, well, this isn't allowed right now. How do we do it? Like, how can we make it happen? So.
Don't know if any of our attendees had any other questions or follow-up questions that they would like to ask.
I have one follow-up question. I don't see anyone typed in, so I'll just ask my one, which was related again to what Leticia, well, kind of Leticia and Rekha were saying about the role of like transportation in a lot of these solutions, right? That like Leticia, you were talking about the rural, like taking on like Musco Rider, which is our rural transport provider. For those of you who aren't from Nova Scotia, rural transit provider, which normally carries people, and as Leticia said, moved to carrying food, bringing food to communities. And Rekha was talking about too, like the distribution, and Tinashe were talking as well about that, the kind of distribution of these foods. So I don't know if any of you has anything in addition to say about that, like the role of transportation in food access.
We did assessments on our food bank on how they were coming just before winter, because we were concerned since they were a little bit more elderly. I think it was 45, 55, because others were driving in together. So between the person who drives in, sharing, and then those who came, majority were either biking, riding, or walking. So that was the first, we kind of helped us do the heat map. And then within our system where the heat map, that we then started looking at how transportation would affect those people. And then what happened is, because a lot of people are walking distance, by winter time, our heat map had so much more people in the core and had more people walking than those who were driving. So I think on our side, we only did one where we did delivery, but within our audience, then there are people who drive to other places because of a convenient day, decided to walk to us. So we had more people walking to us than people driving.
Transportation and distribution is the number one, like it's so essential, and in every single one of our community engagement with every audience in Newfoundland and Labrador, for example, like it doesn't matter whether it was with retailers, restaurateurs, members of the community, like it was always about the transportation, the road network. These are all things that that the municipality has a lot of levers to deal with. So I think that this can be an area that is really powerful, although it then kind of links up to, provincial and federal jurisdiction when it comes to control over transportation infrastructure.
One more thing, thinking more about last mile storage. So we never had, because of that transportation question, we have increased our capacity to store food greater than in the neighborhood than we ever thought before, because of that transportation kind of response.
That's amazing. So in our work in the remote communities in Northern Territory and Australia, part of the asset that we were able to draw on was that store corporation that we work with was also a distributor in the area. So they had some control over their own, distribution hub and warehousing, which gave more, again, just more capacity to balance out the most difficult times.
Yeah, just on that note about sort of infrastructure too, like that's one thing we really found. I mean, it was a major issue before COVID-19, but has been an even bigger issue during this time is, we've got farmers coming in from the valley, which is sort of our bread basket, but they come in for particular dates, and the mobile food market and the other programs that are running on other dates. And so where does the food go in between? Or, if there's these donations that are happening, where do those get stored? So there is a sort of conversation afoot around trying to create like a local food hub with a bunch of different partners and organizations kind of running that together. That would help for the storage issues, freezers, that kind of thing, but also maybe mutual marketing and kind of promotion of the products, and then distribution channels for there, just to try to deal with some of this. But in reality, you almost need those like local hubs in all of our geographies, because we're such a large community. I mean, it would be okay if we have one that's central, but we also need them in all of the sort of corners of our municipality. So that's I think something we really need to be looking at supporting and exploring more.
I think another thing that we should really be looking at and advocating and supporting more is First Nations treaty rights and settled land claims, right? And and I mean, you guys are very familiar with the recent like Mi'kmaq fish lobster traps being destroyed. So when they had treaty rights to earn moderate incomes, and so I think like a lot of this stuff has to get flushed out, and that people, First Nations community, Inuit and Métis, should be able to be able to live off the land and to go back to traditional ways of gathering food and hunting food. And especially in places like we have a community food center in Iqaluit. And so that is a fly-in community, right? And so when you look at it, when you look at places like that, like at this community food center, polar bear is served, seal is served, narwhal is, and that's from the community's local hunting ventures. And so I think there are these other alternatives and things that have traditionally been in place that we need to help advocate for and restore and validate. I think that's another thing, is that and the other thing too, like when you look at things like the Nutrition North program, which helped to try to alleviate the high cost of food because they had to be shipped in. When we look at that issue, and now there are improvements, but that like just being aware of these things, right? Like that money ended up subsidizing vendors, and the vendors, there was no stipulation for vendors then to pass on those subsidies to customers. And so food in Iqaluit and Nunavut remained high, right? And it's like, why? We have this Nutrition North program, what's going on? And so I think it's like, that is another case where the Inuit community was not involved in that program, and around their own food insecurity. And that was like a huge dilemma and mistake, right? Like I think that we've all heard about or know about, or if we don't, we should know about it.
So one thing I've been thinking about just now, 1 year into COVID, 1 year, is just where to from here, because there are many aspects of our food system that it does feel like we've kind of moved backwards, or we've gone a little sideways. And it occurred to me that right before the pandemic, I was just seeing so much more awareness and interest and involvement in food in like new ways in recent years. So, you know, you've all had so many years of experience in the food system. So where do you think we're all going to pivot to next?
I can start if no one else wants to, and I feel like I've been talking too much. But I really think like the big pivot is that, yes, we do need to provide and address immediate needs, and we need to do that and increase access and decrease barriers for folks, like not, you know, having them to prove that they're poor to access these food programs and things like that. Absolutely. But at the same time, I, you know, have to repeat this. I think like food insecurity, food access, it's rooted in poverty. And so while we're doing this work, we need to be really clear about what we're doing and what we're not doing. The public has a perception that food banks and meal programs and all these things are addressing food insecurity, but they're not. They're stopgap measures, right? And they're really important and they have to be done, you know, and people deserve to be treated with respect and dignity. But I think like another thing that we need to be doing is doing that more, looking at the structural change that needs to happen and changing the public's discourse around what they think is the problem, right? If we all keep, you know, food banks and community food centers and if we, you know, say that we are solving that problem, then it won't get solved, right? And I think what we really know that if we look at things, you know, with government income supports that have happened in the past, like with Canada Child Benefit, for instance, that led to a 30% reduction in severe food insecurity among families with children, right? Like we know it works. You know, when seniors become eligible for benefits, the risk of food insecurity decreases, you know, by 50%, right? Like, so we know, I think in the future, what needs to happen. We have to do the work that we're doing in increasing this access to good, healthy, cultural, appropriate food. Absolutely. But I think, you know, as a social worker too, we have to be like, I'm really about interventions, right? So we look at what we're doing, we look at food access and be really honest about what we're doing and let the other problems be solved by the government and by, you know, people who have that, you know, ability and citizens, right? I think we really do need to change the public discourse around it. And I know that's what we're going to be, you know, we will continue to be working on it, Community Food Centers Canada, as well as supporting and continuing to raise funds for our community food centers, good food orgs on the ground. So.
Don't know if any of our other panelists wanted to step in and kind of answer the question that Cathy had asked.
Well, I would throw that the biggest challenge that I think about is the worldview. I think all these things stem from how we've been looking out into the world. We've been sitting at the table, and I think we should just be sitting on the ground together. And so this reconstruction of tomorrow, I think, should not be based on what the past used to be, and probably I'm looking more and changing how I look outside to be able to see how I can create differently. And I think this has been a chance to disrupt old truths. We used to say the economy would do this, that. It's been a year of just doing whatever and making it up as they always did. So that really learning to believe that within the margins, because so many things changed. At some point, the world stood still. And before you couldn't imagine that. You were so scared to stand still because you were being inefficient, unproductive, something. But this time it was allowed to happen. So I think the worldview is what I'm most concerned about, because if we repeat the same lens, like garbage in, garbage out. Thank you.
I'm really hopeful, because I feel like people have experienced during this time food insecurity who never would have experienced it before. You know, the fear about being able to access food, a lot of people experience that who just never would have had that in the past. And so I'm really hoping that maybe the dialogue can continue to shift from a charitable model to really about dignity and agency.
And I'll also answer my own question, I guess. I think there's two things. One thing is really this long-term view, this visioning, like starting from like what Tinashe was saying, really is like public health is a long game. Health promotion is a long game. And so I think that, you know, on days where I feel like there's so many things not working, I try to think, okay, this is a really, like there are crises now, but the changes that we are making, they could have, you know, effects for a long, long time. So that has kind of reinforced my long-term public health view. And then the second thing is I was thinking, you know, what can I do as an academic to, you know, to really help all of you in the best way I can, because the way our work has changed really is in the interconnection also with communities and with policymakers. So one thing I was thinking about was how to make kind of our research and our data sources more available to local, like more disaggregated data available to communities and to decision makers who need it, like more regional information. That's really, really important to me. And also to continue to use academic research as a potential platform for you know, advancing these ideas about the communities that we want, because it is a platform to be able to speak at a conference like this.
Well, I think on that, we do have about a couple of minutes left. So if anybody wanted to say any final thoughts or questions, I can provide that opportunity now, but I wanted to thank each and every one of you for taking the time out of your day to share your experience and knowledge with us around connecting with communities to improve food access during COVID, and how that challenge has just kind of been exacerbated, but also the creative approaches that have been done, as well as to kind of share that, you know, our conference is continuing the rest of the week, and some of the ideas that we've talked about on how access to food involves other connections, such as access to transit. We have a transit panel tomorrow evening, and this public health view as we continue today on our health panel, tonight with speakers about access to health. So if anybody has any other closing thoughts or comments, I can provide you a couple minutes with that now. I guess there's nothing left. So just, yeah, again, thank you very much for joining us today.
Thanks, everyone.
Thank you.
Thank you.
And we'll make the recordings available on our YouTube channel by the end of the week. So we thank our other student organizers for doing that work, and Eric for helping us run this session today on Zoom webinar. Thanks to everyone. We'll hopefully see you from some other sessions.
That's great.
Nice
Thank you. Nice meeting everybody.
Okay. Bye.
Thanks for all the good work.